And today, thanks, Kate. Today, we are really privileged to have Ann Miller from Constellation Consulting presenting to us on the social return on investment. And kind of within our initiative, we've really recognized that evaluation needs to happen in many different ways because it is complex work we're doing when we're bringing together so many different partners and that collaboration part of it. And so we have our HSKE team that does an overall evaluation, has done some case studies. We did a return on investment for healthcare investment, but what's beautiful about the social return on investment is that it really looks at all the partners who are involved in the work. And so in our previous grant, Anne supported us with it, and she's continuing to support us in the work with this. So I will hand it over to you, Anne. Let me just stop my sharing.
That sounds good. And I'll start my sharing.
Super, thank you.
It'll pop up there quickly. Well, thank you and welcome everyone. Yeah, I'm really excited to be sharing about this work today. And yeah, we'll sort of go through the here, I've got an agenda. Do a little introduction and then go through sort of what social return on investment even is. We'll take a look at the People and Community for Living Well SROI analysis. And then we'll have lots of time for questions and discussions. We can talk about, what does this even mean, or what opportunities are there in your own communities? Just by way of introduction, thank you everyone for adding your land acknowledgements and your names and your backgrounds in the chat. I really appreciate that. I read through and it's great to see people from across the province joining. Our group is based in Calgary, but we work actually nationally across Canada, but lots of work in Alberta. We do research evaluation, and then we have a specialization in social return on investment analysis. We do lots of work with different nonprofits, lots of little grassroots groups, also governments or sort of like social innovators or even socially minded businesses. Our website's there if you want to check it out, and my contact information. Have it at the end too if you end up having questions that we don't get to. So what is social return on investment? Let's start there. So social return on investment, as Helen sort of alluded to, is similar to a cost benefit analysis, but it's a bit broader in that we're looking at the value that's experienced by multiple stakeholders, not just, value back to government or value back to investors. We're looking at sort of value community-wide, which can include economic value, but also social value and ways of talking about social outcomes in financial terms, as well as environmental value when it's applicable. There's also the opportunity within social return on investment to value the avoidance of alternative outcomes. So if you've got an initiative that's creating outcomes, we can value those. We can also say, without this initiative, what might the alternative look like? And is there a cost associated with that alternative? And is there value generated by avoiding that alternative? So it's just a more fulsome look at the value created by projects or programs or initiatives or policies. It can be done at different levels. And in this case, it included the Connecting People and Community for Living Well initiative, the whole initiative, I guess, in the first phase. So SROI is an internationally standardized methodology. It's fairly new and emergent still, but Social Value International sort of are the umbrella organization that provide guidance around the methodology. Social Value Canada are part of that international network, and I'm quite involved in both networks, reviewing method documents and things like that. The methodology is similar to program evaluation in lots of ways. And then it's also different from program evaluation in some ways. So the first step is very similar to any research or program evaluation sort of step, establishing the scope. What are we even going to analyze? looking at who the stakeholders are that might be experiencing value and sort of drawing a box around what we're looking at, the time frame for the investment and the analysis. Yeah, all those pieces, if it's going to be an evaluation or a forecast analysis, that's all part of the first step. So very similar to what you would do in any research project. The next step is very similar to sort of creating a program logic model. So step 2 is mapping outcomes. For an SROI, mapping the outcomes involves mapping the outcomes on a stakeholder by stakeholder basis. So rather than looking at outcomes like short, medium, long term, like you might in a program logic model, we're mostly sort of capturing usually medium to long-term outcomes and then looking at who's experiencing those outcomes. So is it the people in your communities? Is it the people in your teams? Is it government services and systems? So who's actually experiencing these outcomes? And the outcomes are mapped in that sort of way. The next step is where we start to sort of diverge a little bit from regular program evaluations. So step 3 is evidencing outcomes and assigning a value. So evidencing outcomes, again, still pretty similar to what you might do in a program evaluation, saying, you know, how many people experience whatever outcome we have that is mapped. And then we look at what's the value of each outcome. So in financial terms, is there a way to represent this outcome? Sometimes it's very tangible and it's a direct cost savings of some sort, or money in somebody's pocket. You know, somebody gets a job, they have income or increased income, and that's a very direct monetary valuation of an outcome. In other cases, we're using different techniques to assign financial value to some of those more intangible type outcomes, some of those social outcomes. So this is the point where it sort of diverges a little bit from regular program evaluation. Then the next step is very unique, I would say, to SRY in that looking at those values, we then say it's sort of the take a step back step. We say, is this actually all because of the initiative that we're looking at? Would some of this value have been created anyway? Have any unintended outcomes occurred because of the work that's happening, and do we need to discount the value to account for that? So it's sort of that take a step back step, and we discount the value based on percentages. If anybody has questions about this, I can go into some more details, and I will when we go through the case study. But yeah, so that's the next step. Then the following step is actually calculating the SROI. So this involves adding together all of the value that's calculated across all of the stakeholders and dividing it by investment that we're looking at. In the end, you get a ratio that would be something like 1 to 3, which says then for every dollar invested in the initiative, $3 in social, economic, and environmental value is created. The final step is the reporting, using embedding, looking at those details and seeing if there's ways to maximize value, sharing the information back out, validating it with stakeholders, and then sort of back to step 1, you can continue to do the analysis, which is sort of the point that we're at now, evolving the analysis to include sort of where the Connecting People and Community for Living Well project is headed now. So a little more on the SROI ratio. So it's the total value of all the outcomes across all the stakeholders. And this is like minus the discount as well, divided by the total investment. You'll get a 1 to something, which says for every dollar invested, however much is created in social and economic value. As I mentioned previously, an example might be a 1 to 3 ratio would mean for every dollar invested, $3 in social and economic value is created. Now, this type of analysis, has its benefits and its limitations. I find SROI analysis is really great in terms of being easy to grasp and creating a communication bridge around complex social initiatives and work on the ground, and being able to communicate that complexity in an easy way that different types of stakeholders might grasp or might be more drawn to. So the accountants and lawyers and bankers of the world get really excited about this type of analysis because it's sort of the language that they speak, and it's translating the great social work that's going on into the language of financial returns. Government also often enjoys this type of analysis, this type of look. For a project or a program, doing this type of analysis can also be really beneficial in terms of having a really detailed look at internal program functioning, seeing where value is actually being created, getting really detailed about who's experiencing value and what types of outcome happening. Yeah, and within that, it's nice that it's very stakeholder focused. So it's not just about let's create some value for government systems. It's saying at the core, we want to be creating value for the people that you're working with. Can we then talk about that value alongside these other more tangible cost savings to be able to say it's not just about trying to create efficiencies within systems. It's about creating social outcomes and well-being for people living in communities. Yeah, and this is sort of goes back to sort of valuing things that might otherwise go undervalued or unvalued. And honestly, sometimes funders are asking for this information. So it can be helpful when you're, making a business case or applying for funding or reporting back on funding. Obviously, there are also limitations. So sort of the flip side, there are a lot of judgments that go into an SROI analysis. So there does end up being sort of a potential for overclaiming, and the flip side, a potential for undervaluing some of the more intangible outcomes like the value of a life or the value of increased well-being. So it's important, I think, to be connected to the international network, to follow the guidance that's set out by the international network, and to be really transparent about all the decisions that are made throughout the process, which we've tried to do in our report on the SRI that we'll talk about today. But there is always sort of this potential limitation. There's a lot of sort of subjective interpretation, which may lead to misrepresentation or misinterpretation of stakeholder values. Some folks find the SRY calculations a little bit complicated. I have a spreadsheet that does it fairly easily, and I understand how it works, so it doesn't seem too bad to me, but I think when you first jump into it, it can seem a little bit overwhelming. And then I would say in Canada, there's a bit of a limitation around just how much SROI is going on in Canada. So it's a little bit more novel in Canada. There's a lot going on in Europe and the UK and even in Australia. But in Canada, there isn't as much standardization, and there just aren't as many case studies to sort of compare with and draw from. So that's a bit of a limitation to using this type of methodology here. Okay, so that's just the highest level overview of what an SRY even is. Now we'll jump into the Connecting People and Community for Living Well SRY example, get into the details of what was included in this particular SRY analysis. And then at the end, again, we'll have time for questions and comments and discussion. So going through step by step, the first step, the determining scope piece for this SROI analysis, we looked at the implementation of the initiative in Drumheller, Innisfail, Stony Plain, Three Hills, and Westlock. So sort of that initial group of communities working with or working to advance well-being for people living with dementia in those communities and their caregivers. The time frame that we looked at was March 2022 to March 2023. And in the end, the analysis used some data from the ROI study, but for the most part, it was a forecast analysis in that we didn't necessarily have concrete evaluation data to use from those communities. So we did some estimating and looked at a forecast style analysis. The stakeholders that ended up included in the SRO analysis as sort of value experiencing stakeholders were sort of the beneficiaries of the initiative, the people living with dementia in communities and their caregivers, but also the members of multi-sectoral community teams involved in the initiative, since their capacity and was potentially impacted by the support received through the initiative. Other community-based organizations who then sort of by proxy are also impacted. The communities as a whole that are potentially evolved into more inclusive communities and more sort of aware of well-being factors. And then finally, the government systems and services. A lot of this, again, was drawn from that initial ROI study that was completed. Looking at how we mapped the outcomes, we looked at existing research, the prior assessment of value through the ROI study, perspectives shared by stakeholders throughout sort of different evaluation processes, and perspectives shared by the project leadership. Outcomes included, and these slides are pretty dense with text, so I'll just sort of, you'll get the slides afterwards and you can kind of go through them, and I think you'll also get the SROI report. But this just sort of as examples for people with dementia living in rural communities. There were outcomes related to well-being, to recognizing their strengths and contributions, to being able to live well in their own home longer. All these outcomes that hopefully are sort of on your radar in terms of what you're striving towards through this type of initiative. Sort of parallel to the outcomes for people living with dementia, we also mapped out outcomes for their caregivers, whereas as communities shift and well-being becomes the focus, and community-based well-being, caregivers of people living with dementia also experience positive benefits within their communities. For the multi-sectoral teams, we really looked at being able, sort of that connection piece, and being able to share knowledge, expand networks, connect with one another, find gaps or address different issues within the community more effectively, and learning between teams and the value from that learning between team members. For other community-based organizations in those rural communities, fewer outcomes were mapped, but there's still sort of that spin-off benefit of having a more collaborative service environment within the community. And similarly, within the communities themselves, as individuals in the community experience change and these teams experience change, the communities themselves likely also evolve towards greater inclusiveness and accessibility. And then finally, and this one's just like too much text on a slide probably, but the outcomes for government were mapped, and a lot of them were sort of based on the ROI study, but also we had a bit more around sort of that efficiency within systems when communities are working together at the community level to reduce potential negative social outcomes. So the next step in the SROI, we looked at each of these outcomes and looked for ways to understand how many people might be experiencing these different outcomes. So again, we looked at existing research, the previous ROI study. We took a look at the information coming out of the monitoring and evaluation data from the project. And if none of these pieces were informed, we made conservative estimates, which are sort of highlighted within the report. For valuing the outcomes, we took a look at whether there were any sort of similar studies, sort of similar sector. Didn't find anything that was like very similar to the initiative, I think partially because the initiative is so unique. but looking at whether there were other Canadian SROI studies that we could pull from. We used valuation from the ROI study, and then publicly available cost data, things related to like public services in rural communities. The next step, we discounted the value for dead weight, which is sort of the counterfactual, the change that would have happened anyway, displacement, the potential that some of the positive outcomes that we mapped maybe had unintended consequences. Mostly, I don't think there was much displacement discounting within this analysis. Attribution, looking at how much of the value is attributable back to the initiative and how much is actually attributable to community-based work and teams. So that's where we saw quite a bit of discounting. And then drop off. So looking at if any of the value was extended into the future, whether that value would drop off over time without further investment. So the final results, which are exciting, the analysis showed that the Connecting People and Community for Living Well initiative in 2022-2023 created over $6 in social and economic value for every dollar invested in the initiative. This value is experienced by those different stakeholders in different ways. So you sort of see a mirror between caregivers of people living with dementia and people living with dementia and the publicly funded services and systems where they're getting cost savings from the outcomes experienced by individuals living in communities. And then there's also sort of proportions of value going back to the teams that are involved and the communities that are involved, including those other community-based organizations that are involved in the community. Again, we tried to avoid overclaiming and make sure that it was a very conservative estimate of value, particularly because we were forecasting. So some of the value we weren't able to capture in financial terms, which means the ratio is lower than if we were able to capture them in financial terms. So things like increased hope or decreased experiences of stigma, we weren't able to very adequately value those within the SROI. So those are sort of part of the story, but not part of the ratio itself. We didn't capture the value of the project's impact on home care in communities. That's maybe a next step in terms of how we're thinking about what value is being created. We didn't capture very well the value of increased awareness within systems of community capacity and initiatives, which was anticipated to lead to increased responsiveness of systems, but being able to capture that value and even having data on that, we weren't able to include it. So the ratio could be higher if that was included, but it's not. And then throughout, we used conservative valuation of outcomes. So not when we go to research the value of different outcomes, often there's a bit of a range of different researched values. For the most part, we picked the lower end values to include in the SROI analysis, just to make sure we weren't overclaiming. And then we went through and tested the impact of those decisions. So that's all recorded in the full SROI report. So that's sort of it in a nutshell. I know that's a quick overview. Yeah, so if you have questions, thoughts, discussion, you can raise your hand, jump in with your mic, enter a question in the chat box. Helen, I don't know if you have anything you wanted to add.
No, just here to help direct once we have questions and discussion happening there. Yeah, maybe
I'll stop the share now, or
yeah, that'd be great. So we can see more people.
Yeah, exactly. That way I can see the chat a little bit better.
Yeah. Hi, Erin. Go right ahead.
Hi, Anne. Thank you for the presentation. Just a quick question. The outcomes that you received from residents or patients and family members and staff, was it survey-based?
No, it was based because we forecast it. So the mapping of the outcomes happened with the project team, with Helen and
Sharon and
Sharon at the time.
yeah.
And also looking at the evaluation data, so what teams were saying they had observed. And then we used the data from the ROI study that was based on provincial access data to understand how many people in the community might be impacted. So that's why it's more of a forecast. Like, we didn't survey individuals living in communities, partially just not wanting to sort of add a focus on that and capacity and time to do that when communities were still working on implementing the initiative.
So we're hoping in this next round that there'll be more of that kind of
Yeah.
information
Okay.
For this next 3 years. Yeah.
Thank you.
Cherie.
Good morning. Thanks, Anne. I appreciate the presentation. I was just reflecting on, I think the SROI is an attractive value, I'm suspecting, for funders. My question is, you talked about the things that you weren't able to capture, and I was wondering about the piece around sort of the impact of, community capacity and collaborations within and their awareness within the system. And I wonder if you could talk a little bit more about maybe why you couldn't capture it, or if you're hoping to do that in another round, because I can recognize that that's probably very complex. But for me personally, that's the thing I'm most interested in. So I'm just curious about how you might tackle that.
Yeah, I feel like we were able to capture a little bit around like what was happening at the community level, like between teams and the collaboration happening within the community. What we weren't able to capture was sort of the impact of community-based work on how those bigger systems work, like the impact back up into Alberta Health. Yeah, I feel like for the next round of work, I don't know that we're going to be able to capture that still, particularly given sort of the uncertainty within the Alberta health system right now. Like, asking people to then reflect on this community piece, I'm not sure if we're going to like realistically be able to do that. But I'm hoping that we'll be able to do a bit more research, or in the last few years that maybe some research has emerged that we can draw upon to better understand that impact. Yeah, unfortunately, I don't know that it's going to be realistically possible. Sorry, I know that's not a great, not a great.
No, that's okay. I mean, it obviously is complex. There's a ton of moving parts in that space. So I was just curious though, because I think it's something that, community collaborators have struggled with for a long time. You intuitively know you're having a system impact, but there's really no good proof of it.
Yeah, and we've definitely struggled with that as well, to be able to show that.
Hi, Heather. Go right ahead.
And thanks very much, Helen, and thanks, Anne. And I guess maybe to remind, kind of follows a little bit, my question follows a little bit after what maybe you were getting at. So Anne, if I was to look at your pie graph, right, of the stakeholders that experienced a return on investment, it looked like maybe like kind of 1/3 or so might have been in the public healthcare sector, if I'm recalling that visual right. So my first is, does that then equate to, like, out of your 6, then like a $2 return on investment to the public health? Yeah, I'm seeing you nod. Okay. Then my next question then is around, are there thresholds on social return on investment that help us to make a case to decision makers, especially in a period of upheaval in healthcare? To be able to say, like, a ratio of X or higher is sort of like a decision factor that would weigh more heavily or less strongly in terms of how people would interpret these findings for their particular stakeholder group?
Yeah, I get that question a lot, like in terms of like, what's a good SROI ratio? I would say anything 1-to-1 and above is honestly a good ratio. So if you get a 1-to-1 ratio, you're sort of demonstrating to, like, or if it's a 1-to-1 ratio for government or for public systems, you're demonstrating that the model that you're using is equally efficient and effective as what's going on otherwise. And you can then make a case that, but maybe you would rather have, you know, this stuff happening at the community level. I know I worked with the group in Calgary doing like community-based housing for people with really complex needs. And the ratio was quite low, like it was like 1.5 to 1 or something. But the case is it's a better quality of life for folks to live in the community than to live in an institution. So anything 1 to 1 and above. And then as you move up, yeah, you're showing that the community-based model is creating greater and greater value for multiple stakeholders. So yeah, the ratio coming out of this particular initiative, I think in the report, we actually pulled the ratio just for government as well to say, so there's this, you know, return to public systems. Yeah, and that can make a really great case for, okay, you're going to spend the money anyway, you could be getting better value for that money that you're spending. But there isn't necessarily the other caveat to that is there isn't necessarily like a list of SROI ratios someplace where you say, okay, we're here, we're above this or below this, unless you're comparing sort of apples to apples, like a similar or the same approach, using different techniques or different approaches to the same issue. You can't really compare SROI ratios. Like if you're comparing between homeless organizations and health organizations and food delivery organizations, like those ratios aren't really comparable because what's going into it and the investment that you need to create outcomes in those different sectors are so different.
Thanks.
Yes.
And Sharon.
Oh, I have to unmute. Yeah, and this is a real question about social return on investment or return on investment. And it comes back to something I learned back in Ontario so my husband had a stroke in 1997. And in 2004, I was talking to a Ministry of Health official, and I said, surely to God, we could carve off some portion of the money that would cost to keep him in long-term care, because that's where he was scheduled to go, to do community rehabilitation and provide some community services. By the way, my husband, 28 years from stroke, has just come home from shopping and driving his car. And the other thing is, he has not spent a day in hospital since he's been home. So the return on investment there, I could say, is a lot. But the Ministry of Health official said to me, but Sharon, he said, that nursing home bed will be filled regardless. You're talking about new money. So same thing, in Alberta, our health care services, emergency and hospitals can show that demand. How do we say that moving services to the community is important and that these community things that we're doing are important?
Yeah, I think that's a really great point and a really great sort of reframing that needs to happen in terms of how we're talking about this this ratio. So when we're looking at value creation, like for public systems, I think usually people's minds jump to, oh, that's a cost savings for the system. And basically it's not. It's more of a cost reallocation. So if you're showing that these public systems experience a certain amount of value because people aren't, showing up to emergency room or aren't spending a long time in hospital, that sort of stuff, or not ending up in continuing care, it doesn't necessarily mean that the emergency room doctor is going home early that day, or that the budget that they're spending on emergency medicine is going to be decreased, that they'll have money in somebody's pocket at the end of the day. It's more experienced as, I would say, a cost reallocation in that you're creating space within those systems for people to access the system when they need to. So there's one less person in line for that service. You're getting potentially more efficient emergency services or hospital spaces are available, but it doesn't necessarily mean that the hospital is like closing a wing because 10 people aren't going to be in that wing. Yeah, so it is a different way of talking about that value. And I think as the results are presented, it's really important. Like, I'm really happy that you brought up this point, because it's important to not talk about the SROI as like cost savings necessarily, because it is really more of that cost reallocation. So I appreciate that nuance.
And the same thing happened, so just when I was back in doing my master's in public health, they'd done a really lovely project at Shepherd's Care, where they'd got people working together, and they were, and as a result, there was far fewer ambulance calls, and they were saying we just they could reallocate that funding, but it doesn't work that way. So the question is for this group is, how do we reframe that? How do we talk about it?
One of the interesting things to me is that we're hearing a lot from all over the place around how much our aging population is going to cost the system based on present day delivery of services. And I wonder if that's part of this conversation, is pulling it back to say, well, there are alternatives. You're calculating it based on this many people moving into facility care. Whereas if you looked at investing in this area, the costs may be, on the other side of it, right? And that would lower the overall demand, I guess. Yeah, as you were saying, Anne.
Yeah, like status quo versus like more innovative approaches or community-based approaches.
Mm-hmm. Sure. Are there other questions for Anne?
I'm just peeking at the chat to see if there's anything. I don't know if anything came up there that
more comments. Sharon has added a couple resources in there. And then Mary was talking about kind of value versus deficit there. Did you want to say more about that, Mary?
Sorry, I was just, I'm trying to make sense of this, because we do think about disease rather than health, right? And I think what Sharon, you can correct me if I'm wrong, but I think what we're trying to like reframe is this notion about like, all our funding needs to go towards a very extreme acute care like system versus how these individuals actually provide value. And, life is actually valuable and disease is not as valuable. So I don't know, Sharon, if you want to comment, I don't know.
Yeah, but Karen Chan, it's what matters to you rather than what is the matter with you, and that quality of life that's important, is part of that, and that reframing, like how, we talk about moving services closer to home, but we live as if the hospital's the only place for care. And we also, the other piece of this is we need to value care as much as we value cure.
Mm-hmm. Yeah, that's close to that quality of life, right? And the impact for caregivers as well as the person living with dementia in this situation. Yeah. I just see Cindy, you have your hand up there.
Yes, thank you. Hi. So we're doing a project in Saskatchewan, in Saskatoon, where we support families and patients, residents transition from acute care into alternative level care beds. And, we're really good on like the quantitative, part of it with our health economic modelings and all those things, but it's interesting to bring in the qualitative, through those lived experiences and, by using interviews and stuff like that. And we're always just blown away by the drastic impact, that just sitting with a family, putting a nice, a hand on their shoulder, and like those small social aspects can really drastically change, the quality of life and outcomes for these families as they transition, as what we would like to transition back into community or to their home of choice. So, I would just like to, where you talk about step 3, assigning a value. I don't know, Anne, if you'd be up for a meeting sometime with our modeler, or, just to kind of dive into that piece, while we're collecting this data. I think it's really cool, but can you expand a little bit on like how you assigned a value a little bit more?
Yeah, for sure. Yeah, there's different ways of looking at assigning value, especially when you're looking at from the individual perspective. There's some like more tangible values. So, like if somebody's not paying for respite support, or somebody's not paying to go for counseling or something because they are being supported in a different way in the community. There's also well-being valuation techniques. I'm not sure if you've taken a look at some of those, where you're looking at how much change. So it's sort of a whole methodology. It's a lot of it's coming out of the UK, but there's a few researchers through public health actually, like at the national level, that have taken a look at well-being valuation in Canada, but looking at the general social survey and then data sets around like income and things like that, and looking at how much change in well-being do you need to have an increase of however much in income, and then looking at that in terms of other factors. So how much change in like, I don't know, neighborhood satisfaction or something like that creates the same amount of change in well-being, which you can then tie back to that income change. And so it's an interesting technique. I'm happy to, chat further about it or share some of it with your researchers. There's actually, there's a bunch of different techniques. Some of them require like, a big data set to get people to say how much, like willingness to pay, like how much would you pay to have this outcome? I just completed an SROI with a long-term care facility. So I have a ton of that research, like sort of top of mind if your researcher would like to chat about it or see some of the stuff that I've been looking at and drawing on.
Absolutely. Yes. Thank you so much.
Yeah.
I think Kate put Anne's email into the chat
nice.
earlier. And then as we send everything out, will be part of what we send out also. So can make those connections. Yeah. Any other questions or comments? I love Sharon getting us talking about those kind of that big picture impact with all of these, trying to bring all these pieces together, right? Yeah. Sharon, you just said in there that the project that Cindy had talked about is about social frailty and how much it is a better predictor than physical frailty.
Yeah, they're taking people that are in alternative level of care beds and actually with some supports, moving them home, to where they want to be at home. And it's a really exciting project. But in how do you and that when you've been in hospital for a while, those long hospital stays, 3 months, you've often heard of those happening now. Somebody doesn't, when they come home, it's like, how do I cook? It's getting people used to doing that again, and figuring out how they're going to get their groceries or do their shopping, or that, you really need a navigator to help you do that. And so, that project that Rosalind Compton and Cindy are working on, and Cindy's Team Care Pal is just doing yeoman's work. Again, I was talking to Jamie Stewart yesterday, who's the learning design studio we collaborate with a lot. And he was talking about Cindy's navigation within the Teen Care Pal app being superior to many other things. And I don't know whether Cindy's demonstrated it here, but she really needs to.
So she did have she did. There's a recording of that presentation on the panel, but certainly we can look at that. I think that would be so interesting to see. Sorry, Sharon, go ahead.
And the other thing that Jamie said to me yesterday, a resource list is not a navigation resource. And that's why this connecting people and communities is so important, because what it is those relationships, those connections, the connecting people you're actually connecting them. It is that navigation piece that is such a pain point for family docs and caregivers and people with.
Yeah.
And I just got off I was late because we were talking to nurses about the Alberta Caregiver Strategy and Action Plan. So from the nurse, these are nursing educators, and they were talking about how hard it was for them to navigate as family caregivers.
Mhm. Yeah, for sure. That relationship and building the trust so that you know when you call that person that you're on the same wavelength. It's so key to all of this work, right? That connecting
Yeah, and
part of it.
anybody
Yeah.
that wants to talk to us about, we're working on an Alberta caregiver strategy. We've got the beginning of a framework. We're cohorting people. Anybody that wants to talk to us about it, I'm happy to send it to them and happy to have you chat with in one of those round tables that we're having at the moment.
Super. You bet. Thanks, Sharon, for sharing that. Any other questions or comments today? Great discussion going on. Love sharing these kind of broader ideas because it's really, I think it's going to take a lot of different things to make this system transformation that needs to happen as we head into the future here, even in our little bit more than a little bit uncertain times, but it's also an opportunity to be looking at things different. Just seeing there. Hear from Pam saying, yeah, navigation is extremely complicated and exhausting at a challenging time for people needing support. Absolutely. That's right. That it's when you need it the most. Yeah. Yeah. And then Kathy reaching out to Sharon there about the interviews that were done before. Great. Well,
Kathy, that's
maybe.
today's work.
Yeah. She'll be getting back to you there. Very good. Great. Well, thanks so much, Anne. And if people have questions, please, connect with Anne. She put her email address in there again, and or through us, that's just fine too. We can make those connections. I'll bring
thank
up.
you so much for inviting me to speak and be involved in the project and analyzing the SROI.
Yeah, we so enjoy our work with Anne. It's been great. Now, I'll just look at this one here. There we go. Great. So just to finish up with a couple of things here, just wanted to highlight that our next meeting is on February 25th. And actually our team from the Drumheller Community Seniors Coalition is going to be presenting, and I'm quite excited to have them come. We've been working with them for about 9 years. They started with us way at the beginning part of this initiative. And so just to see some of the great networking and innovative programming that they've been able to do. And so that'll be shared on February 25th there. And just a few resources that we had found about. Yes, Pam, you had shared with us around the Wood Buffalo Health Neighborhood. And so here's some information about that. And then I also added in there the promising practices for enabling aging in place Healthcare Excellence Canada, which is the same funding group that Cindy was talking about that grant in. They've got just a list of different promising practices that they've gathered over the last, I guess it'll be a year now, in their work in this area with it. And then our project update will be shared with everyone when Kate sends out the recording of this partners meeting. And then I think that's everything from today. Just wanted to share also just that we're have the opportunity to that we now have a new manager with our team, and that's Shauna McGann. So we're really happy to be now part of the Provincial Seniors Health and Continuing Care team with Alberta Health Services. And so really, we're so lucky to have Shauna because she knows our work so well. So that's been a great move for us there. So I think that's everything that we have for today. Any other questions, subjects that we want to discuss? Okay, well, thanks everybody for joining. We will see you next month.